If you're thinking about getting pregnant or actively trying, this is something I talk to my patients about all the time. There is a phase that doesn't get enough attention, and that's the preconception phase, the time before you see a positive pregnancy test. And medically, this phase is so important because many of the earliest stages of fetal development happen before most women even know they're pregnant. So today, I'm going to walk you through what you should be doing right now to prepare your body, your skin, and your overall wellness. Let's start with aesthetic treatments because timing matters. Treatments like Botox, dermal fillers, laser treatments, and microneedling are generally not recommended during pregnancy. This isn't necessarily because we know they're harmful, it's because we don't have enough data to confirm safety in pregnancy in pregnant patients, so we avoid them. So from a clinical standpoint, if you are trying to conceive, this is the window where you can plan ahead. If you know you are not pregnant in a given cycle, this is the time to complete your neurotoxin treatments, address volume loss with filler if appropriate, stimulate collagen with treatments like microneedling or laser. This allows you to maintain results throughout pregnancy when we pause most elective aesthetic procedures. Of course, this should always be done in coordination with your provider so that timing and treatment selection are appropriate for you. Next, internal health and nutrient support. From a medical perspective, one of the most important things you can do before pregnancy and ensure adequate nutrient levels, especially folate. Folate or folic acid plays a critical role in early neurodevelopment, particularly in the formation of the neurotube, which develops very early in pregnancy. That's why most guidelines recommend starting prenatal vitamins before conception. In addition to folate, optimizing B vitamins, iron, and hydration levels can support overall maternal health as your body prepares for pregnancy. This is where therapies like IV hydration, when medically appropriate, can be used to support hydration and deliver key vitamins. But again, this should be individualized and guided by a provider. Now let's talk about skin maintenance during this phase. While more aggressive treatments are paused during pregnancy, there are still safe ways to maintain skin health. Facials can be continued as long as they are pregnancy safe. Medical grade skincare can also be used, but certain ingredients like retinoids should be avoided. So during this phase, I recommend focusing on hydration, skin barrier repair, gentle brightening. This helps you maintain healthy, resilient skin throughout pregnancy. And lastly, this is something I always emphasize to my patients. Preparing for pregnancy isn't just physical, it's also emotional. There can be a shift in how you feel in your body, your identity, your routine. And taking this time to feel your best, whether that's through your health, your skin, or your confidence, is not just vanity, it's self-care. So just to summarize, before pregnancy, focus on strategically timing your aesthetic treatments, optimizing your nutrient levels and hydration, establish a pre-pregnancy safe skin routine, and always work with a qualified provider to guide you through this process safely. If you're in the pre-pregnancy phase and want a personalized treatment plan, I love creating these for my patients because every woman's journey is different. And my goal is always to help you feel confident, supported, and empowered every step of the way.